Hi, and welcome to Detours, Understanding Acquired Brain Injury. I've been away for a while. I've been ill, but I'm back, and I want to talk about something that's a little off of our normal path, talking about traumatic brain injury. I want to talk about something that still, though, falls under the umbrella of acquired brain injury, and that is talk about cerebrovascular accidents. Now, cerebrovascular accidents refers to any kind of bleeding or interference with circulation to different areas of the brain. Now, most people imagine one of the types of accidents that occurs, the ischemic stroke. And an ischemic stroke refers to, what's traditionally thought of as, grandma's stroke, where blood flow is cut off to the brain, a certain area, and it's an isolated loss of skills, usually of speech or trouble with motor movement. And you'll see these posters up in maybe a bus station or at the hospital or whatever, where it says about think fast, and it'll tell you things to do to detect and to determine if someone's having a stroke, so you can get them help within an allotment of time, usually 90 minutes, although it has now been expanded because of certain medical procedures as they become more advanced, in order to reverse the effects. But what we're talking about here is more related to hemorrhagic strokes, to the kind of accidents with circulation, incidents with circulation where there's a leak or a rupture of a blood vessel, and the damage is far more extensive. And it often happens to younger people. It's not to discount the concerns of the elderly, who do definitely have problems with their cerebral circulation, but usually these kind of problems with ischemic strokes, where the blood flow is disrupted due to a clot or an embolus, it's more about looking at how, with a disruption of blood flow due to a sudden event, is one that you really don't know about until it suddenly happens. Whereas with the stroke, they're typically the traditional ischemic stroke. One could predict it based on poor diet, based on uncontrolled hypertension, based on factors of living mainly. Whereas with the cerebrovascular accident that we're talking about, the hemorrhagic stroke, it's due to weaknesses in the blood vessel, weaknesses due to various factors that one is born with, genetic, hereditary factors, sometimes trauma, but usually it's something somebody is born with. So we're going to jump in. We're going to do a quick survey because we'll get into greater detail at a later point. But I do want to talk about, at the kind of surface level, what you're looking for when it comes to these kind of incidents. Now, first of all, I'm going to use my brain again, because what I'm going to talk about is areas that are typically affected. When you're dealing with a cerebrovascular accident of the hemorrhagic type, what you're looking at is how you would divide up the blood vessels. Now, this does not have the blood vessels on it, but you can think of it as affecting three major areas. These arteries, the arteries that feed the brain, can be thought of as being divided up into superior and inferior, where they come into the brain through what's called the circle of Willis, which is below the brain, which then breaks off and feeds from below. And then there are the anterior blood vessels, which feed, with apologies, there are the superior blood vessels, which feed from the top. And then you have the anterior, which feeds the frontal lobe, the middle cerebral arteries, which feed the midsection, and the posterior. Now, those of you who remember my neuroanatomy and neuropsychology would understand that the anterior arteries that feed the frontal lobe would affect things like executive skills, planning, organization, emotional regulation and control, risk-taking behaviors, impulsiveness, those kind of things. So if one were to have a major bleed there, were to have a hemorrhage in this section due to disruption of blood flow here, for example, the anterior communicating artery, those kind of behaviors would be manifest. With a disruption of the blood flow there, with either an ischemic type or with a hemorrhagic, which again is more typically what we would see in a younger person, that's what would be seen. With the middle cerebral arteries, one would expect more to see problems with speech, coordination, motor skills, sensory, and proprioception, balance, coordination, possibly some aspects of speech. As you can see here, these areas respond to coordinate speech, reading, lexical skills, mathematical skills. Your angular gyrus is here as well. And you can see this area is fed by both the middle cerebral arteries, especially here on the left side, as well as the posterior. So a bleed in either one of these areas would affect those kind of skills. The angular gyrus is here, and that helps decoding symbols. So abilities of mathematics would be affected with understanding representational diagrams, things like that. A little further down below, you have your Wernicke's area, which would also be affected. That would affect the ability to recognize language and linguistic symbols, the ability to make sense of the words you're using, your dictionary, basically, your mental dictionary. So if that is impacted by a bleed, again, through the middle cerebral arteries. On the opposite side is also sensory inputs for the opposite side of the body. So as this is the right hemisphere, coordination and the ability to control the left side of the body. If there are middle cerebral bleed into the motor cortex here and the sensory, it would affect one's ability to control the left side of the body here on the right side, and vice versa, of course. So if there were a bleed into the middle cerebral artery, it would affect the ability to control the right side of the body, as well as many of those other sets of skills. And finally, the occipital area. Bleeds on either side would affect the visual fields and the ability to visually associate objects. So things like visual agnosia, the inability to recognize, say, a key for what it is or what it does, would be impacted by a bleed back here. And then finally is the cerebellum down here, and it's fed by its own arteries, but hemorrhage here would affect the ability to coordinate one's movements smoothly. And so those kind of bleeds can affect coordination and can even affect some of the thinking skills, since it seems as though as research is ongoing, so the cerebellum also does have an effect on overall cognition as well. Then there are portions of the brain inside the various white matter nuclei, the various white matter tracts, connections to the gray matter nuclei. Disruptions of blood flow here would affect throughout the entire brain. And the only way to correct these problems would be to perform surgery and to evacuate the hemorrhage. Now, when I'm talking about ischemic strokes, these can be fixed with either interventional neuroradiology, where one were to stick a wire up into the artery and pull the clot out. It's done under fluoroscopy. It's a very careful procedure, but it is something that can be fairly straightforward in doing. And if you do it within a certain amount of time, it used to be 90 minutes, now it can be as long as up to 6 hours they can do it. But still, you want to find out if somebody's actually having one of these. So what you want to do is find out the last time a person with symptoms, for example, they can't say their name, they can't repeat a phrase like the sky is blue in Cincinnati, which is where the scale was developed. If they smile, does one side of their mouth droop? That's a suggestion of a problem. If their grip strength is not equal, if their eyelid is drooping, these kind of things are signs that they're having potentially an ischemic stroke. Hemorrhagic stroke is different. Usually a person who has bleeding in the brain will just collapse immediately, and that's obviously always a 911 situation. And usually the fatalities are fairly high, about 15% people survive these. So it's long odds. Now, what causes these kind of strokes? A hemorrhagic stroke typically is due to 1, 2, 3 different things. First of all, one of the most common ones is what's called an arteriovenous malformation, an AVM. And that is a hereditary problem. This is something you'll have since fairly soon after conception. As your brain is developing, the circulatory system is developing, the arteries and the veins kind of become tangled, and they form this abnormal, very unstable connection. And it's just waiting for something to cause it to rupture and bleed. A sudden surge of blood pressure would cause it. Excitement, a change in intracranial pressure, whatever may have caused that, will cause it to burst and to bleed into the brain. It many times is fatal. It'll happen to young kids as their bodies are growing and as the tissues are beginning to change, stretch, and expand. And if it's the AVM is barely holding together, it may just rupture, and an 8, 10, 12-year-old kid may just fall over and die because their AVM became unstable. Obviously, the repair for that is surgical. You have different options. Many times they will literally just clamp off and will remove the damaged entanglement, and they'll reconnect the artery and the vein as they should be. Another one is what's called an aneurysm, which is a weakness in the blood vessel wall where it balloons outward. It's in the artery primarily. Veins are low pressure, but arteries are under pressure, under higher blood pressure, and they will balloon out. And as blood pressure changes, they may burst and leak potentially, or completely rupture, depending on the nature of the problem that you're dealing with. But when they start to leak, you may get neurological symptoms. You may get visual changes, changes in your hearing, changes in the speech. And that's a warning that something is seriously wrong potentially. And if it goes to a rupture, again, you can have massive bleed out in your brain. And it may be fatal, or you may be seriously disabled by it, depending on where the bleed is, whether it's a frontal lobe bleed, whether it's temporal, or whether it's occipital. The procedure for handling this is to coil it, which is where they will follow along the artery, and they will place a metal coil in the ballooned area in order to block it off. And they may use thermal ablation to seal it shut, or they may go in surgically again and clamp off the balloon section of the artery to keep it from continuing to expand. Also, they may decide to use a laser and cut seal as well. There are glues, and that's a possibility as well. Removal is the last resort. And sometimes they'll do what's called watchful waiting, which is to monitor it. If it isn't serious enough to warrant the risk going in there, they'll use MRI, and they'll use what's called MRA, magnetic resonance angiography, which is where you will use MRA technology, but you will use it by injecting a dye, and you will use that to observe how the blood vessels are behaving in there. You use gadolinium or something along those lines. You inject it, and you will watch how it travels through the blood vessels, and with the MRI. And since it's interactive with magnetic fields, you can see how it travels through the blood vessels and see how the arteries are behaving, and whether they're ballooning, whether they're expanding, contracting, whether they're staying the same. That's an MRA. But it uses the same technology as an MRI. It just uses a magnetic tracer, and you're looking just at the arteries. So that is an MRA. It's painless, except for them starting the IV, and then they inject the magnetic. It's not radioactive. It is a magnetic dye. gadolinium, which is a paramagnetic element. And so that pretty much covers. One last thing. You need to remember, this is transient ischemic attack, which is called a Ministroke. It is a transient event. For a moment, you may have some symptoms as though you had a stroke. It's a warning. It's telling you, see your physician. If you briefly lose your speech, briefly lose your hearing or whatever, it means that momentarily, due to vasoconstriction, the blood vessels tightened up. It's telling you something's wrong with your circulation to your brain. It's telling you it's sensitive. It's telling you you're at risk for a cerebrovascular accident. Get the help of a neurologist. Go see your neurologist if you have any of these symptoms. Even if they go, you need to see a neurologist. I cannot stress that enough. So that is cerebrovascular accidents. You can get some symptoms like a stroke from certain types of migraine headaches. You are, again, at increased risk for stroke if you have these types of symptoms. It doesn't mean you have it, but it does mean you're at increased risk and require vigilant monitoring. So that's a brief overview. I will be getting into more detail in the future, but this is just a quick view of cerebrovascular accidents and types and areas of the brain that are impacted. So welcome back to the channel, and hope you found this instructive. Thank you very much. Have a good day.